Hey, future RN, let's talk about anticoagulants. These are one of the most tested medication classes on the entire NCLEX, especially when it comes to bleeding risk, those key monitoring labs, and patient teaching. So today, we're going to break down everything you need to know about heparin, warfarin, and the DOACs so you can walk into your exam and answer these questions with total confidence.
Welcome to ClearPath NCLEX. This is your go-to spot for the high-yield content you absolutely have to know to pass on your first try. So let's just dive right in.
Okay, first things first, let's start with the basics. Before we get into all the different drugs, we need to be crystal clear on what these medications are actually for. What's their main job?
So what even are anticoagulants? Well, the name kind of gives it away, right? Anti means against, and coagulation is just the fancy word for forming a blood clot. So simply put, these are the meds that work against clotting to prevent a dangerous clot from forming in the first place.
Now, pay really close attention here because this is a huge NCLEX trap. You have to remember, anticoagulants do not bust up or dissolve clots that are already there. That's a different class of drugs called thrombolytics. The job of an anticoagulant is to prevent new clots from forming and to stop any existing clots from getting bigger. That's a critical difference.
So why are these drugs so important? Well, we use them for some really serious, life-threatening conditions. Think deep vein thrombosis, or DVT, and pulmonary embolism, a PE. They're also absolutely essential for patients with atrial fibrillation, that's AFib, to prevent a stroke. And you'll see them used all the time after major surgeries, like a hip or knee replacement, where the risk of forming a clot is super high.
All right, now that we've got the basics down, let's get into the three main groups of anticoagulants. The NCLEX expects you to know these like the back of your hand.
So, the three big players you absolutely must know are Number 1, heparin, which comes in two forms, unfractionated and low molecular weight. Then there's warfarin, you'll also hear it called by its brand name, Coumadin. And finally, the newest class, the DOACs. That stands for direct oral anticoagulants, and this group includes drugs like apixaban and rivaroxaban.
So let's get into the nitty-gritty of how these drugs actually work. Each of these classes has a totally unique way of stopping the clotting process. And if you understand that, it makes remembering all the side effects and monitoring so much easier.
Okay, take a look at this table. It really simplifies things. Heparin works by supercharging a natural protein in our body called antithrombin, which then goes and blocks other key players in the clotting cascade. Warfarin is different. It's a vitamin K antagonist. It basically gets in the way of vitamin K, which is needed to make certain clotting factors. No vitamin K, no clots. And then you have the DOACs, which are way more direct. They go straight for the target and block either thrombin or something called factor XA.
Okay, I really want you to tune in for this next part, because this is where the most important, high-yield NCLEX questions are going to come from. We're talking about risks, side effects, and the specific labs you have to know.
If you remember only one thing from this entire explainer, please let it be this. The number one, universal, most important risk for every single anticoagulant is bleeding. It just makes sense, right? We're stopping the body from clotting, so the patient is automatically at a higher risk for bleeding.
So let's break this table down because it's packed with must-know info. For heparin, you are always going to monitor the aPTT and the platelet count. Why platelets? Because a big drop could mean a super dangerous complication called heparin-induced thrombocytopenia, or HIT. Now moving on to warfarin, you monitor the INR. That's the key lab, and the goal is almost always a therapeutic range between 2 and 3. And lastly, with the DOACs, one of their biggest advantages is that you don't need any routine lab monitoring.
All right, so knowing the drugs is only half the battle. As a nurse, knowing how to educate your patients is a massive part of keeping them safe, and it's a huge topic on the NCLEX.
You have to teach your patients to report any signs of bleeding right away. That means things like unusual bruising, pink or red urine, dark, tarry-looking stools, or even just bleeding from their gums when they brush their teeth. Now, specifically for patients on warfarin, they have to keep their vitamin K intake consistent. Not cut it out completely, just keep it steady. And for everyone on these meds, avoiding other drugs that can cause bleeding, like NSAIDs and aspirin, is absolutely critical. Oh, and a classic sign of internal bleeding, a dropping blood pressure with a rising heart rate. Gotta know that one.
Okay, you have soaked up a ton of information, so now it's time to put it all to the test with a few NCLEX-style questions. You ready? Let's see what you've got. All right, first question. Read it carefully. I'll give you a second to pause and think about it.
And the answer is INR. Remember our rule.
Warfarin goes with INR, and we're looking for that magic number, that therapeutic range of 2 to 3. Okay, next up. Think about the specific complications we talked about with heparin. What does a sudden drop in platelets make you worry about? Take a moment.
The answer is heparin-induced thrombocytopenia, or HIT. This is a really serious, life-threatening complication. It's where the body actually creates antibodies against heparin, which causes platelets to drop, but weirdly enough, it actually increases the risk of clotting.
And for our last practice question, which one of these drug classes is the exception to the rule, the one that doesn't need constant blood work? Think it through.
And that's right, it's the DOACs. This is one of their biggest selling points. Drugs like apixaban and rivaroxaban don't need that routine blood work to check if they're working, which is a huge convenience for patients.
All right, let's wrap this all up with the absolute must-know facts. Go ahead and take a screenshot of this slide for your notes. So for heparin, you're thinking aPTT and HIT. For warfarin, you're thinking INR and vitamin K. For DOACs, you're thinking no routine labs. And for every single one of them, the #1 priority is always, always, always bleeding risk. You've totally got this.
You know, anticoagulants are so predictable on the NCLEX. If you can just master these key connections and always prioritize those bleeding precautions, I promise you, you will absolutely crush these questions on exam day.
Thank you so much for watching ClearPath NCLEX. If this explainer helped you, please give it a like and subscribe for more high-yield content. And don't forget to hit that bell so you never miss the next game-changing NCLEX tip. Now, I have a question for you. Drop a comment below and let me know, which anticoagulant do you find the trickiest? I read every single comment.